My name is Juan Juana, and I'm a graduate student recruiter and third-year DNP student here at the University of Pittsburgh School of Nursing. Today I'll be reviewing Beyond the BSN, which are graduate nursing programs that we offer here at the School of Nursing. Today we'll discuss the Career and Advanced Practice Nursing, Pitt's graduate nursing programs, and the application process. The school is consistently ranked in the top 10 by the U.S. News and World Report and the top 20 globally. Our DNP programs are ranked 8th, MSN programs are ranked 6th, PhD programs are ranked 10th, and we're 6th in the National Institutes of Health funding. We're 9th in the Nursing Administration programs and 11th in the Nurse Practitioner programs. Advancing your education beyond the BSN allows you to keep up with the pace of the changing demands of healthcare and the nursing profession, also allows you to develop new skills, research and practice innovations, and advancing your education means you have increased opportunities. So we offer 3 different graduate nursing programs here at the University of Pittsburgh. We have the Master of Science in Nursing, or the MSN, Doctor of Nursing Practice, or the DNP, and Doctor of Philosophy, or the PhD. Our MSN program builds on the BSN competencies with concentrations and focus areas and prepares nurses for advanced roles in leadership, education, research, informatics, and direct patient care. So there are 2 nurse specialty roles available in the MSN programs, the clinical nurse leader and the nursing informatics. The clinical nurse leader improves the quality of patient care by developing skills in leadership, education, quality, and safety. This is a leadership role for nurses who want to make a difference in the clinical setting or provide leadership in educating others to gain these skills. The clinical nurse leader assumes responsibility for patient care outcomes by coordinating and supervising the care provided by the interdisciplinary team. This is a BSN to MSN degree with fall, spring, and summer term admissions, full-time or part-time options, and online or on-site options. Nursing informatics. This is a combination of information science, computer science, and nursing science. They develop, analyze, and evaluate information systems that support, enhance, and manage patient care. Career options are in practice, clinical information systems, database management, and evaluation of informatics projects. This is a BSN to MSN degree with fall, spring, and summer term admissions, full-time or part-time options, and online. Next, we have our doctoral nursing degrees. So these are terminal nursing degrees for nurses looking to gain advanced practice nursing roles, leadership positions, and develop new nursing science through research. We have our Doctor of Nursing Practice, or the DNP, which is a nursing practice focus. Then we have our Doctor of Philosophy, or the PhD, which is a nursing research focus. Starting with our DNP, or Doctor of Nursing Practice. This is the highest level of nursing practice. The DNP prepared nurse is a superb clinician and leader in the healthcare delivery system, and they implement the most current evidence-based nursing science and practice innovations. We offer several different concentrations, including the adult gerontology clinical nurse specialist, nurse midwife, nurse anesthesia, nurse practitioner, and nurse specialty role, which is the health system's executive leadership. So the DNP in adult gerontology clinical nurse specialist, this is a practice focused on areas that are often defined by a population, setting, or disease type. They work in health promotion and protection and management of problems frequently seen in adults with acute, critical, or complex chronic health problems. Clinical nurse specialists practices within 3 spheres of influence: the patient or client, nurses and nursing practice, and organization or organization system. Students may choose a clinical emphasis in cardiopulmonary, critical care, oncology, trauma, emergency preparedness, or directed study. This is a BSN to DNP or MSN to DNP program. It offers fall term admission, full-time or part-time, and on-site or online. And the online option is available for post-MSN to DNP students. Next, we have the nurse midwife. The nurse midwife provides services to foster a supportive environment for women and families before, during, and after pregnancy, including well woman care. Graduates are prepared to function in a full range of services for women from adolescent to beyond menopause. Assume independent responsibility for promoting, maintaining, and restoring health while diagnosing and managing health problems in women and childbearing families. They also attend births in home, birth centers, and hospital settings, and provide primary health care for women and newborns. They also participate in quality improvement efforts and lead in mobilizing community health resources. This is the BSN to DNP program with fall term admission, full-time or part-time, and on-site for BSN to DNP. Next, we have our DNP nurse anesthesia. Graduates of the nurse anesthesia program are prepared to safely administer a full range of anesthetics and render perioperative anesthesia nursing services to patients of all ages and acuity levels in a variety of healthcare settings. Students administer over 800 anesthetics and provide over 2,500 hours of direct anesthetic care. This is a BSN to DNP with spring term admission, full-time, and on-site only. Next, we have our nurse practitioner programs. The nurse practitioner provides comprehensive care and management of patients with acute and chronic healthcare conditions. These include health promotion, disease prevention, health education, and counseling. They may practice autonomously per their individual state regulations. The areas of concentration for the nurse practitioner are adult gerontology acute care, adult gerontology primary care, the family or the individual across the lifespan, neonatal, pediatric acute care, and pediatric primary care, and psychiatric mental health. This is a BSN to DNP or MSN to DNP program with fall term admission, full-time or part-time options, and on-site or online options. And lastly, we have the health system's executive leadership. This is a program that prepares nurses to function in executive leadership and management roles that focus on creating or redesigning systems to meet the demands of the emerging healthcare market. This program prepares nurses for leadership of a large, complex healthcare organization or department. This is an MSN to DNP program with fall term admission, full-time or part-time options, and it's online or on-site. So the general admission criteria for the BSN to DNP is a valid RN license in the state or US territory in which the student wishes to complete their clinical practice requirements in DNP project. Also need a 3.0 GPA or greater in the BSN program and a competitive GRE, a prerequisite statistics course within the last 10 years, pre-admission interview, and there are other program-specific criteria available on our website. The general admission criteria for the MSN to DNP is a valid RN license, again, in the state or US territory where the student intends to complete their clinical practice requirements and the DNP project, a 3.0 GPA or greater in the MSN or Master's in related field with a BSN, a competitive GRE score, prerequisite statistics course within the last 10 years, clinical experience in the focus area is required in some programs, but we also require a pre-admission interview, and other program-specific criteria are available on our website. Next, we have our Doctor of Philosophy or PhD. So this program prepares nurses to develop new nursing science through research. It's the highest level of formal education for a career in nursing research and scholarship of advancing the science of nursing. Graduates develop new nursing science, serve as leaders of the profession, and educate the next generation of nurses. The PhD offers different focal areas of research, including technology used in patient management, patient adherence to treatment, cancer survivorship, genomics, behavioral interventions in chronic conditions, symptom management, and primary prevention in chronic disease. There's funding available for full-time students on a competitive basis. This is offered as a BSN to PhD or MSN to PhD program. with fall-term admission, full-time or part-time, and on-site only. The general admission criteria for the PhD is a valid RN license in the US state or territory, competitive GRE scores within the last 5 years, pre-admission interview, 3 letters of reference, essay and second writing sample, and for MSN to PhD, require a GPA of 3.5 or higher for the master's program, and program-specific criteria are also available on our website. We have other post-BSN opportunities. These include certificates and minors. So we have post-baccalaureate certificates in healthcare genetics, nursing research, school nursing, and post-MSN or DNP certificates in adult gerontology acute care nurse practitioner, gerontology for nurse practitioners, neonatal nurse practitioner, psychiatric mental health nurse practitioner, nursing education, and nursing informatics. We have MSN and DNP program minors in gerontology for nurse practitioners, healthcare genetics, nursing administration, nursing education, nursing informatics, and nursing research. The general admission criteria for post-BSN certificates include a valid RN license in a state or US territory where the student intends to complete their clinical practice requirements, a 3.0 GPA or greater in the BSN or MSN degree, pre-admission interview, and other program-specific criteria are available on our website. The general admission criteria for the post-MSN certificate are a valid RN license in the state or US territory where the student intends to complete the clinical practice requirements, a 3.5 GPA or greater in the MS, MSN, or DNP in the related focus, and pre-admission interview, as well as program-specific criteria, which are available on our website. Next, we have our accelerated second degree option. So this is a quicker route to a bachelor's degree in nursing. Credits are given for previously completing a degree. So essentially, you get to skip over general education and focus on nursing. This is full-time in-person and on-site. It offers didactic and clinical experience in 3 consecutive semesters with 18 credits per semester, 810 clinical hours. It's fast-paced and can be completed in 11.5 months. These are 6 semesters of curriculum delivered in 3 semesters. The admission criteria for the ABSN is a bachelor's degree from an accredited institution in any field of study, a minimum 3.0 cumulative GPA on a regular 4.0 scale, completion of all prerequisite courses, but this is not required in order to be admitted. These are some of the prerequisite courses that are required. So these are not required for admission, but they do have to be completed prior to starting the program. So our online application is available at nursing.pitt.edu. You can go on there and upload your resume and essays, and you can use that same website to submit your letters of recommendation contact information and request all of your official college transcripts. If you have more questions about our programs, please visit us at nursing.pitt.edu/request-information or call us at 412-624-4586.